In this brief video, I'm going to be revisiting the case study of Victor Leborgne. Victor Leborgne was born in 1809 in France to a family of 7. Historical evidence indicates he was partially literate and developed epilepsy at an early age, although the exact age of onset is unknown. At 30 years old, he mysteriously lost the ability to speak except for the word tan, and he eventually sought medical attention after initially thinking his condition was temporary. After being admitted, he was eventually transferred to the care of surgeon Paul Broca. After being hospitalized, several deficits were observed for Leborgne. Again, he was only capable of saying the word tan in most cases. He had to use bodily gestures to communicate, and there are controversial accounts of his intellectual capacity. And then he had no signs of physical trauma. Over time, he also developed vision loss, paralysis in his right limbs, and a gangrenous infection in his right leg. Shortly after being transferred to Paul Broca's care, Leborgne passed away. The next day, Broca performed an autopsy on Leborgne's brain, and the following starred regions are the ones he indicated had been damaged. Although Broca is credited with discovering speech localization in the brain, modern researchers have discovered that many additional regions were also damaged in Leborgne's brain. All damaged regions, though, either discovered by Broca or modern researchers, correspond with Leborgne's observed deficits, as they seem to impact speech production, language processing, motor functioning, and general efficiency of neurological processing. Leborgne's condition is now referred to as Broca's aphasia. In his case, this was allegedly caused by an ischemic insult or an obstruction in the brain arteries. Subsequent cognitive decline, such as his paralysis in his limbs, has been attributed to further vascular insults. Long after Leborgne's death, CT scans and MRIs have been used to continue analysis of the extent of his brain damage. Other techniques that might be useful for this include diffusion tensor imaging and voxel-based morphometry, which can be used to detect abnormalities in white matter. If Leborgne were alive today, modern treatments might have helped with his condition. Some of these modern treatments include speech rehabilitation and melodic intonation, and also current research is underway to establish whether medical treatments might be available for people with Broca's aphasia. Some ideas for these medical treatments include drug therapies, transcranial magnetic stimulation, and transcranial direct stimulation. As for his paralysis, modern treatments might include physical and occupational therapy. There are several ethical concerns surrounding Leborgne's case. First, it's questionable whether he received any adequate treatment during his hospitalization. Today, it might be more compassionate if he had been transferred to an assisted living facility or hospice. Second, there's lack of any evidence that he was offered any kind of psychotherapeutic treatment to alleviate any mental distress he might have experienced as a result of his condition. And it's common for individuals experiencing terminal or debilitating conditions to develop depression or other forms of psychopathology. And it's just as important to address someone's mental health needs as their medical needs. Third, there might be a lack of valid or reliable methods for assessing psychological health in individuals with limited communication capacity. And last, there's no evidence that Leborgne consented to have his brain preserved for science, which might suggest a prioritization of scientific discovery over the rights of the deceased. So, in conclusion, discussion of Leborgne's case should include the discoveries of both Broca and modern researchers, and discussion of ethical concerns and modern techniques in cognitive neuroscience could highlight the complexity of Leborgne's case. Here are my references, and thanks for watching.